This video is the second of 2 videos explaining the ongoing treatment of wounds with Amicapsule until wound closure. You will need to check and treat your wound daily. Remove the dressing as gently as possible if you were wearing one. Proceed slowly and cautiously without jerking or tearing. It's fine if debris is stuck to the gauze and lifted out with the removal of the gauze. This can happen in the early stages. Should you experience that a dressing, gauze or viscose, is stuck to the clean wound surface, shower over the dressing until it can carefully be removed without harming the wound bed or edges. The best way to clear the wound of debris and dead tissue while not harming the new tissue is by showering using a relatively high water pressure. The water makes the distinction between what needs to remain and what needs to be removed extremely well, and it does not cause harm to the tissue. Wash the wound thoroughly with water from all angles without using any soap, shower gel, wound irrigation solution, or any other cleaning products. If showering is out of the question due to special circumstances, a wash bottle can also provide a good pressure. However, a few refills may be needed. If, after showering, there is still a thick layer of dry, shiny black or tough yellow or green debris or slough on the surface, remove as much as you can with a swab. Then wash again to make sure you get everything off that you have loosened. This will only be relevant at the beginning of the healing process. After that, always leave the water to distinguish what to remove and what to leave. These are examples of very different wounds, all cleaned correctly. Very gently dab the wound dry. Don't rub or scrub it in any way. Use only vertical movements. It's okay to leave the wound and surrounding skin moist and ready for Amicapsule to stick to the surface, but do not leave any standing water. Next, apply Amicapsule. Start by rubbing Amicapsule gently into the skin around the wound edges. Apply it well beyond any area of skin that does not look absolutely healthy, even if it may seem far from the wound opening itself. Ensure you cover any reddened areas. And inflamed skin, and any white protruding areas, or areas with callus, as well as any new skin that remains slightly elevated. Make sure to also cover all nodular skin in the vicinity. In all circumstances, cover at least 5 mm of the surrounding healthy skin. If the amicapsule will not stick to the skin surrounding the wound opening, use a swab wetted with tap water to apply moisture to the area. Then, gently massage the amicapsule into the skin. Next, sprinkle amicapsule onto the wound surface to create a layer between 1 and 3 mm thick. Smooth the amicapsule with gauze or a finger to ensure complete and even coverage, including the underside of any overhanging surfaces. If the wound is deep, ensure all sides and the bottom are thoroughly covered with an unbroken layer of amicapsule. If the wound surface cannot be turned into a horizontal position for application, the gauze that will serve as dressing can help during the application. First, attach the gauze below the wound. Apply an even layer of amicapsule to the gauze at the estimated place of the wound. Gradually, from the bottom up, adhere the gauze to the skin. Top up with amicapsule where needed. Continue fastening the gauze to the skin. Using both hands will help. In a similar manner, to apply amicapsule to a downward-facing wound, apply amicapsule to a gauze and use the gauze to dab upwards. Before redressing, check the skin carefully for any redness along the tape line. Tape allergy tends to get worse every day, and it will usually halt the healing until it has resolved. If you identify signs of allergy, please immediately change the type of tape you use, or stop using tape altogether. It is really important that you only apply a single, woven, 100% cotton gauze. Your wound must be able to breathe. Notice the difference between a woven and non-woven gauze. Only use tape along the edges of the gauze to secure it. This will allow the wound to breathe. In the case of tape allergy, a gauze strip can be applied and secured by tying the ends together in a knot. Alternatively, remember that a dressing isn't actually required. In that case, apply only as much amicapsule as will stick to the surface of the wound. Should this wear off, reapply it again 12 hours later. It is not necessary to wash the wound again when reapplying. If the dressing or wound at any point gets soiled or wet, either from the outside or from excessive sweating, remove the dressing, shower and dry the wound, and apply a new layer of amicapsule. Access to air is essential. If at all possible, avoid covering your wound with items of clothing. Don't forget, your wound needs to be able to breathe, even at night while you are sleeping. If you must cover your wound, then only use items made of natural fibres, such as cotton, wool, flax, or silk. Do not use clothing or duvets made of synthetic fibres. If you have no other option than to block your wound from air, for example if you have to sit on it or have to wear shoes or special boots over it, you can use a small portable battery-driven air pump to blow air from your surroundings over the wound surface through a slim tubing. The tubing can run under the gauze dressing. Do not run the tubing under the foot or directly under the sitting bone. If possible, change the path of the tubing to the edge of the wound slightly every day. As explained in Part 1, the healing process is characterized by 3 main steps: drawing out the infection, restoring lost tissue, growing new skin. Once the infection has been drawn out completely and the tissue and skin are in the process of being restored, you can discontinue the daily application of Amicapsule and continue to simply wash your wound daily and ensure access to air. Remember, this only applies if you do not suffer from any immunosuppressing conditions. If you do, you should continue applying Amicapsule until you achieve full wound closure. Use this checklist to ensure that your wound is free from infection. Your wound should be rid of all the features in the left column. These features are covered previously in relation to infection. The right column mentions a few of the many positive signs of healing to make sure these are not misinterpreted. If there are any signs of infection, it is too soon to stop applying Amicapsule. After Amicapsule is no longer needed every day, you must still continue to treat the wound correctly as an Amicapsule healing wound until full closure. Wash the wound daily with tap water and nothing else. Dry it very gently as usual. Remember that the wound must continue to have unhindered access to air all through to full closure. Other than that, leave the wound in peace as much as possible. If the wound gets wet or soiled, wash it with tap water. Shallow wounds can be left uncovered and will very soon display a flexible, resistant, protective surface. This will quickly develop into a healthy protective scab. Or they can be treated as deep wounds. On deep wounds, apply a paper-thin interface dressing of dry viscose threads, knitted or woven with holes sufficiently open to be able to see through. The viscose interface dressing must contain no coatings, no silicone, no adhesives, nor anything else. You cannot use the 100% cotton gauze you've been using until now, as this will stick to the wound surface. You should check daily that the wound shows no signs of discharge either on the wound or in the removed dressing, if you are wearing one. A watery, yellowish, transparent liquid can appear. This is lymphatic fluid and not a problem. Also check that the skin along the wound edges shows no sign of trouble, such as redness and heat. It should not appear severely unsettled or enraged, regardless of whether there is scab. Make sure that the wound also continues to reduce in size. If your wound is covered with scab, this should be left in place. Scab is your wound's own protective dressing and is part of the healing process. It will fall off by itself when the new skin underneath is ready to let go. Do not confuse scab with eschar. Scab appears late in the healing process. You should daily check the scab in 2 ways. Gently press down on the scab at a 90-degree angle and watch whether any droplet of liquid appears anywhere in the scab or along the border of the scab. And observe whether the intact skin along the border of the scab is enraged or the redness seems to be spreading. In both cases, the scab should be removed, the wound washed thoroughly, and Amicapsule applied as originally. A single application is usually enough, and you can go back to not using Amicapsule. All through the healing process, extremely thin flakes, not scales, may appear on the skin surrounding the open wound or the scab. These form part of the healing process and should not be actively removed. They are not a sign of dryness. Also, do not apply moisturizer or similar. This would cause a setback in healing. After the wound is closed, the tissue will continue to restructure for years. It will take 6 to 8 weeks to regain strength and resilience. During this time, do not use any type of sanitizers or antimicrobial shampoos or soaps within 10 centimeters or 3 inches of the scar. These can appear as antimicrobial, antibacterial, antiseptic, or disinfectant properties on the label. You can use a mild natural soap or shampoo. Also, do not use moisturizers or any other types of creams, ointments, or similar. The surrounding skin, as well as the healed wound itself, may continue to produce the flakes. This is a sign of continued healthy regeneration in the surrounding skin and the underlying tissue. As before, treat them with care and do not apply anything to them. They will disappear in their own time as the skin matures and gains strength.